Hello, this presentation is in partial fulfillment of NSG 576, Nursing Central and Integrating Social Media into the Classroom by Lewy Barra. So Nursing Central is a smartphone application that I've identified that can be used to increase student engagement within the classroom, as well as within the clinical setting. It can be described as an all-in-one bundle that provides access to multiple applications and up-to-date learning programs, tools, and resources. I've had the opportunity to use this program while in nursing school and still continue to use it today to look up medications that may be unfamiliar. However, there have been many new updates and changes to this application that have made it a very smart choice to use in today's nursing education. So to begin, it can be accessed via smartphone or using a personal computer, as I'm doing right now. It provides integrated information regarding certain terms, diagnoses, medications, peer-reviewed articles, lab values, and calculations, which I'll go over briefly. It costs $179 for the initial subscription service, however, $100 for each renewal. A fun fact, though, is that if you don't renew it, you can still retain the program on your phone and use it as long as you keep that phone. This app can be enhanced with several add-on programs specialized for specific nursing professions and for NCLEX review. So as mentioned, it has some of these fun applications to be used: Davis's Drug Guide, Tabor's Medical Dictionary, Davis's Laboratory and Diagnostic Tests, Diseases and Disorders, and as well as Nursing Pocketbook or Pocket Guide. It has GRASP, which is a study system which you can use to create cards for learning, Glimpse, which you can define words in text. Another fun thing I think I like about this program is that it'll have information that's integrated, meaning that if I'm looking into diseases and disorders, such as, for example, asthma, it would provide me with nursing diagnoses and what I would do in order to help ensure they have um, adequate perfusion and ventilation and those types of things. So Davis's Drug Guide. A fun thing I think about this is that it provides information on drugs that are um, maybe have been discontinued or off the market, and even kind of differentiates between the Canadian medications and names for them. It has updates and then also kind of what you would look out for when providing or administering a specific medication, um, and what patient teachings would be required. Tabor's Medical Dictionary. I think this is kind of underused, but they actually have a lot of illustrations and videos that you can look at, which I found very, very useful, and I was not aware they had so many. In addition to that, it also helps you pronounce some of these medical terms that we use. Davis's Laboratory and Diagnostic Tests, as mentioned, it provides information on what labs we would be doing, what diagnostic tests we would see, factors that may influence the results that we may see, and then also what are some potential patient outcomes, nursing problems, and what treatments may be possible with that. Nurse's Pocket Guide, as previously mentioned, it provides NANDED nursing diagnoses, and it also actually assists with care plans. Diseases and disorders. So it provides information on over 240 diseases and disorders, the assessment, diagnosis, planning, factors that would affect this disorder, and what you would like the patient to understand in patient teaching. It also provides some pharmacological highlights, which I think is pretty neat, about what medications you would commonly see with a specific disease. Okay, here I will show the exact application itself. This is the PC version. You can see some of our applications that I went over. In addition, here are some other fun things that I think would be very useful for students. We have GRASP, which is study flashcards. You can actually create your own deck. As you see, I have one for cardiac and pharmacology. You can also find them, which is kind of neat. You have some that are common meds, male genital urinary system. So pretty useful, I would say. In addition, I think one of the biggest things that I was not aware of that have been integrated or updated into this program is the use of case studies. So you have this case study where you have someone with COVID, and it provides you a lot of information about what the presenting problem is, history, what vitals and assessment information you can receive while looking at this patient, and then also what questions you would ask to help the student critically think about what they would want to do and how they would want to care for this patient. I read this and it looks like they're actually going to be having a bunch of new case studies implemented into this program, which should be very neat and very useful, and is even more encouraging about using it in the classroom. In addition, there is medical journals you can access, and they are actually very, very up to date. I actually get notifications on my phone still about certain diagnoses, medications, and things like that that you would see. Using social media in nursing education. So in more recent years, nursing accreditation bodies are encouraging nursing schools to incorporate nursing informatics and technology subjects in their curriculum to prepare nursing students to practice in technology-enabled clinical environments. So with social media, you can see that it incorporates a lot of programs such as Facebook, Twitter, TikTok, YouTube, Flickr, Wiki, podcasts, and blogs. It actually reduces barriers such as scheduling, time constraints, costly interactive face-to-face learning scenarios, and can improve interprofessional education and international nursing partnership programs. Students are more motivated and engaged in deep learning activities when provided a voluntary, self-directed, and student-centered nature of learning with an anytime and any place setting. Social media can improve accessibility, communication, professional and ethical development, as well as serve as an affordable teaching and learning innovation. So ways that you could see this incorporated into the classroom is through concepts of cognitive learning theory, such as reflective learning, um, such as using Twitter to increase involvement through the process of reading, commenting, and discussing other students' responses. Scenario where you could see this is perhaps in a critical care course, where students are responding to specific questions and able to describe the changes to a patient's status throughout the whole scenario. You could also incorporate it through cooperative learning strategies. So one instance in this is where healthcare and technology issues encountered at work using Facebook. For students, this provided a creative way of interacting, and the students felt this was more enjoyable as an online class activity. And then also critical thinking, which can be facilitated through the use of YouTube as a supplementary teaching medium. So clinical skill videos can be used to promote clinical competence development, provided students receive guidance regarding the programs used. And I completely agree with that. As long as the instructor is able to find really beneficial and useful videos. These are the references, and I want to thank you for viewing this presentation.